It's been called the epidemic within the pandemic. The number of people dying from a drug overdose hit a record high last year. Dr. Daryl Shorter, Medical Director of Addiction Services at the Menninger Clinic, joins me live now. Thanks so much for being on with us. When I look at this number, I mean, it is staggering to me. A record 93,000 deaths in 2020. That's about a 30% jump. What's your reaction to this data that was just released this week?
It's quite sobering, actually, and I'm very concerned, not just from what's taking place nationally, but also what's taking place here locally in Houston.
Talk about that, Dr. Shorter. What have you noticed here in Houston and Harris County?
Yeah, here in Harris County, in partnership with the Harris County Institute for Forensic Sciences, my research group and I have been looking at overdose data and have found that the trends that we've seen nationally have also been represented here in Harris County and in Houston. So it's very concerning and something that we definitely want the public to be aware of.
And the nation was already struggling with this epidemic, before 2020. Can you point to the pandemic then as making it worse because people were more isolated and maybe treatment was harder to get?
Absolutely. So we had been noticing that there were national trends as well as local trends with increases in drug overdose over the last several years. Much of that had been related to opioids, and in particular fentanyl and fentanyl analogs. But as a result of the COVID-19 pandemic and all of the associated fallout from the pandemic, we absolutely saw an increase in the number of overdoses in our communities.
And you mentioned fentanyl. Why is that opioid specifically up?
Well, fentanyl, it turns out, is fairly easy to manufacture, and it has flooded our markets. In addition, because it is so potent, about 100 times more potent than morphine, it's often used to cut other kinds of substances. And so people might believe that they are getting one substance, but they're actually getting a reduced amount of that substance in combination with fentanyl. And if they've never had fentanyl or other types of opioids before, it actually increases their risk of overdose from that substance.
I see. So if family members know they have a loved one who is struggling and they just don't know where to even start, what should family members do to just get the ball rolling to help their loved one?
Well, the good news is that treatment works and that treatment is widely available. There are places in Houston like the Council on Recovery and also places here like the Menninger Clinic, which is where I work. We have a team of addictions professionals and addictions counselors who are available to provide personalized treatment for addictive disorders to allow for diagnosis, management, and treatment. We use a combination of things like psychotherapy as well as pharmacotherapy to treat substance use disorders. Other things that our community should know about are naloxone. Naloxone is a medication that is an antidote to fentanyl and other kinds of opioids, and having access to naloxone or Narcan can really save or reduce a drug overdose when it comes to opioids.
Well, it is a huge problem, and not only across the country, but as you highlighted here in our area. And Dr. Shorter with the Menninger Clinic, thanks so much for coming on. And we wish everyone out there who is struggling, the help that they need. Thank you.
Thank you for having me.